The clinical instruments. So guys, now we are going to talk about clinical instruments and how they came to be and why you use them the way that you do today. The stethoscope. Stethoscope was one of the first diagnostic imaging devices out there. The origin story was that in 1816, René Laennec was a shy French physician who was uncomfortable pressing his ear on a young woman's chest to listen to the heart. So what he did, he rolled up a paper tube, placed it on her heart, and heard the heart more clearly than ever before. This became the monocular wooden stethoscope. Why this matters? It matters because it turned the subjective listening that I think I hear into an objective measurable value like auscultation. This signals the reasoning of modern diagnostic methods. So these are the drawings of the stethoscope that Mr. René came up with, and these are some of the drawings of the lungs. The techniques that it shaped include auscultation of heart sounds, where we can hear now murmurs and gallops, of lung sounds, where we can hear crackles, wheeze, and stridor, and of the bowel sounds, where we can differentiate between obstruction and ileus. So there are 5 areas to listen to the heart, and you can use this mnemonic. All people enjoy Time magazine. So first you have aortic region, where you put your the bell. I forgot the term. Where you put your stethoscope on top of the right second intercostal space. Then you have the pulmonic region, where you put which is located near the left second intercostal space. Then you have the Erb's point, which is at the left third intercostal space. And then you have the tricuspid, which is at the left lower left sternal border at the fifth intercostal space. And then you have the mitral spot, which is at the left fifth intercostal space, medial to the midclavicular line. So this is another diagram: aortic, pulmonary, Erb's point, tricuspid, and mitral. And these are basically the locations that you will best hear the heart sounds at. And there are murmurs involved with each location. For example, if you talk about systolic murmurs, you can look at aortic stenosis, aortic valve sclerosis, and flow murmur. Similarly, you have various types of murmurs. I think it would be better if we go into it the next time we are actually discussing murmurs, because there is a lot. So here we have the reflex hammer, which is neurology in a stick, as can be seen demonstrated here. In the late 19th century, neurologists needed a simple tool to test spinal cord integrity. John Hoffman, William Gowers, and John Taylor popularized different hammer designs. Reflex hammers evolved along with our understanding of myotatic reflex arcs. Why this matters is that it translated spinal neurophysiology into a quick bedside test and helped us understand upper motor neuron versus lower motor neuron patterns within seconds. Techniques and the uses it shaped. For example, the knee jerk led to understanding of the L2 to L4 nerves, ankle jerk with S1, biceps with C5, C6, and triceps with C7. The ophthalmoscope, seeing the only place where you can directly see the blood vessels. So the origin story goes like this. In 1851, Hermann von Helmholtz invented it. Before this, the inside of the eye was a mystery. Here is a portrait of the guy. The reason that it matters it unlocks the non-invasive view of the retina, optic disc, vasculature. It was the first instrument that allowed real-time visualization of systemic disease. And this is an image of an ophthalmoscope. For example, you could see something like this viewing through the ophthalmoscope, where you have a vein, you have the optic nerve, you have an artery, you have the macula, and you have the fovea. The techniques that it shaped include diagnosis of papilledema, diabetic retinopathy, the hypertensive changes, and assessing optic nerve for raised ICP, intracranial pressure, that is. So for example, here the above image is an early phase, is in the early phase of papilledema, and this is the acute phase. Here we have some other images talking about other findings, for example in hypertensive disease, and then vasoconstrictive phase of the disease, and yeah, we'll move on. I don't understand why the video, like the image, is scrolling up and down. It's just, in this image we see glaucoma, and compared to the normal optic nerve, compared to the papilledema. And here you can see the difference between the pressures of inside the eye and outside the eye. Now we have the otoscope, which is the window to ENT, and here is an otoscope, and here is the otoscope placed inside. The origin story of the otoscope is that it evolved from an early specula which was used in the ancient Rome. The modern designs were shaped by Wilhelm Kramer in the 19th century, and added on top of it, lightning and magnification changed the course of ENT forever. Key purposes were to inspect the tympanic membrane, to diagnose otitis media, to remove wax, and to detect perforations. In this image, you can see the tympanic membrane, the posterior fold, the anterior fold, the cone of light, and all the other features that you will see on a normal image. And similarly, you have the right ear and the left ear. And here you have, on the left side, you have a view of the normal tympanic membrane, and on the right side you have a view which changes consistent of the with otitis media. You can see there is bulging of the membrane, and there is prominent dilated vessels. Now you have a picture of the left central left tympanic membrane perforation, as you can see over here. And that is it with our ENT stuff. We are going to look at the spiganomanometer, which revolutionized how we measure blood. Well, it was firstly how it was the first tool that we used to measure blood. The interesting story is quite interesting. That is, in 1896, Mr. Riva created the first inflatable cuff, and in 1905 Korotkov identified the Korotkov sounds, which are the systolic and diastolic values which are heard while measuring the blood pressure. Why does this matter? This mattered because it turned BP from guesswork into a measurable vital sign. This enabled diagnosis of hypertension, and which ended up changing the cardiovascular mortality rates. So in this image you can see basically how the cuff is placed on the arm, and with the pressure being allowed in, as the pressure is like slowly released, the first sound that you hear is going to be the systolic one, and the last sound that you hear is going to be the diastolic one. So these days we have other types of blood pressure measuring instrument, like electronic digital spirometer, a manual mercury one, and an aneroid one. So this table talks about comparison of the American and European definitions of hypertension. Generally we can think that to be more than 130 by 80, and for Europeans 140 by 90. And there is going to be a lot of differences in the management, but we'll discuss about this when we get to a part of discussing hypertension. Well, this is like an image, as you can see, based on the readings. If we are able to get a proper reading that okay, the person is hypertensive, based on the age, we'll think about what medications that we want to start, and the ethnicity. And there is a lot of stuff in here. but I would like to proceed forwards because I would like to get done with this because there is just so much stuff that we need to cover today. Then we have the thermometer, which was the first objective vital sign. The origin of the thermometer was that Santoro was first attempted quantifying temperature, and in 1714 Daniel Fahrenheit, yes, that Fahrenheit, made a reliable mercury thermometer. Later on, we had digital thermometers, and which led to there being infrared tympanic thermometers. Now we get to the tuning fork, which is the neurologist and the ENT specialist's secret weapon. The origin of this tool was that it was invented by John Shore in 1711 for tuning musical instruments. Later on, it was repurposed for medical use centuries later. So the uses that we have are at 128 hertz. We can use it to check for vibration sense, and at 512 hertz to check for air versus bone conduction in ENT with René test and Weber test, which are demonstrated over here. On René test, you place it like this. On Weber's test, you place it over the head. I would love to get into the detail, but let's just move on. Now, talking about the ECG machine, from frog legs to cardiology. The origin of the ECG machine was that in 1940s, Emil Debo noticed that there was electrical activity in the muscles. In 1870s, dogs and frogs were said to have cardiac impulse recorded, and in 1901, William Antoine invented the string galvanometer, which was the first ECG. So this is our guy, and this is like an illustration which demonstrates that there is nervous transmission of a chemical nature. And this is one of the first ECG machines in history. The clinical impact was that there was sudden transformation of cardiology. We could look at things like myocardial infarction, arrhythmias, and electrolyte imbalances, electrolyte disturbances.